Live, I'm Verna Barrett. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TDT, Talk City 91.1 FM, and on Facebook at TDT Live Online. We go now to the Manager, Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning. We are pleased to have you with us again today for the Ministry of Health's virtual media conference, which delivers an update on the ministry's COVID-19 response. On my left, probably your right, we have Dr. Roshan Seeramsingh, Chief Medical Officer, Dr. Osafo Fraser, County Medical Officer of Health for St. George East, and also with us another Roshan, but Roshan Seeramsingh, our GIS Manager. I'm Candice Alcantara, your moderator this morning. Dr. Parasram will lead us off with the clinical update.
Hi, good morning, Ms. Alcantara. Good morning to Dr. Fraser and Mr. Seeramsingh, members of the media, members of the viewing and listening public. So I'll just be giving the clinical update for this morning for January 29, 2021. The total number of tests submitted thus far to the public and private facilities now stand at 83,058. Over the last 24 hours, we would have reported 13 additional positive cases, taking our total number of positives since March 12th to 7,533. Our total recovered patients now stand at 7,127, giving us an active total caseload at 272, with 134 deaths. Our total number of persons in isolation now stand in 216, that is those in home isolation. The number of patients at hospital are at 40, total in step down 3, and total patients in our state quarantine facilities are 365. With regards to our step down facilities, as I said, we had 3 persons, 2 of them at the Claxton Bay Correctional Facility, 1 in Tobago. With regards to our hospitals, at the Couva Hospital and Multi-Training Facility, there are 25 persons, 3 persons in ICU, Cora Hospital 14, and the Scarborough Regional Hospital at the Signal Hill, there's 1. With regards to our quarantine sites, 340 as of this morning, spread between a number of facilities. At the Kapok Hotel, there's 107, Cascadia Hotel 42, Aria Suites 8, Chancellor Hotel 10, Tradewinds Hotel in South 26, Cara Suites 8, Freedom Hall 3 at UWI, Canada Hall 59. At the Napa, there are 42 persons, and at the Regent Star, there are 38. So, Ms. Alcantara, that brings me to the end of the clinical update for this morning.
Thank you very much, Dr. Parasram. And we go now to the other Roshan Seeramsingh, who will give us a presentation on COVID-19 cluster patterns in Trinidad and Tobago.
Thank you. CMO Dr. Parasram, Dr. Fraser, Ms. Alcantara, members of the media, and our listening and viewing audience. Good morning. As we switch to the first slide, this morning we'll be taking a look at the spread of COVID-19 cases over the last 2 weeks, firstly, and then we'll be taking a look at the clusters. So as we go across to the first slide, we'll see, and we go again, we'll see how the cases recorded over the last 2 weeks, more specifically, during the period January 17th to January 30th, 2021, have been spread across the country. We are seeing that quite clearly there are cases which are spread across the entire country in each of the counties during this period. But what the map also tells us is how many cases were recorded per community. Just to point out, these are not clusters, these are community maps. So each of the shapes, each of the small shapes you see within the map, each of those represent one community and not a cluster. What we are seeing, though, is that there are quite a number of cases which we continue to see in the east-west corridor, that general St. George Central, St. George East, up until St. Andrew, St. David area. There's one particular community that appears to be a little bit red, a little bit bright, and it stands out in the map. Just to point out that is one community which would have recorded 5 cases. Again, it's not a cluster, it's a community. The map also shows us communities which would have recorded cases within the last week in particular. Those are the communities which are highlighted in blue. And again, we see that these communities are spread across the entire country in various counties. As we shift from the community map and we go to our clusters, which we see in our next slide, we'll be looking at a comparison of the clusters which were recorded during the period on the left, the 27th of December to 9th of January, which covers the epi weeks 53 of 2020 and 1 of 2021. And on the right, we see the cluster map for the period January 10th and January 23rd, 2021, which covers the period epi weeks 2 and 3 of 2021. At first glance, it's quite evident that there's an increase in the number of clusters across the country during this latter period compared to the former period of December 27th to January 9th. The increase is quite evident as we have increased from 8 clusters during the former period to 14 clusters during the period January 10th to 23rd, 2021. We continue to see a handful of clusters in South and Central Trinidad, where there actually being one less cluster during the period January 10th to 23rd when compared to December 27th and January 9th. Now, to get a better understanding of these clusters, as we shift to the next slide, we see what the counts per cluster looks like. During the period December 27th to January 9th, the 8 clusters recorded the cases between either 4 or 5 in each instance. So each cluster had either 4 or 5 cases within it. However, when we look at the period January 10th to January 23rd, as we look at the 14 clusters, we see that there's a little more variance. Yes, there are several clusters which would have recorded between 4 and 6 cases, but we are also seeing clusters which recorded as many as 18 and 12 and 10 cases each. I'll point out in that particular cluster with 18 cases, 3 homes alone recorded 13 cases. So 13 out of that 18 was split among 3 homes. Now, we continue to use the GIS technology to support decision making as we move from community to cluster spread. It's important for us to appreciate the use of the technology as we go forward, not just in identifying the clusters, but in supporting the decision making which comes thereafter. So we have a case with 13 out of 18 cases in one cluster coming from 3 homes. That's 3 locations within one cluster. That speaks volumes, and it speaks of what is taking place within the home. It speaks of what is taking place among family members and at the same addresses. Now, as we go to the next slide and we take a look at the table, we see that in each of the statistics, each of the indicator mentioned, there would have been increases during the period January 10th to 23rd when compared to the period December 27th to January 9th. The number of clusters increased from 8 to 14, as mentioned previously, and as expected, the number of cases within the clusters increased. This time from 38 cases within clusters to 95 cases within clusters. Now, the highest number of cases within any cluster, as mentioned earlier, during the period January 10th to 23rd was 18. And during the period December 27th to January 9th, the highest number of cases in any cluster was 5. Now, as we look at the clusters which had spread within the home or within the family or the same address, we see that during the period December 27th to January 9th, there were 5 clusters which had at least 1 case of spread within the home or the same address, whereas during the period January 10th to 23rd, or epi weeks 2 and 3 of 2021, 11 out of the 14 clusters recorded instances where there was spread within the home or at the same address or within the same family. That is interesting to note because we went from 5 out of 8 to 11 out of 14. Now, the maximum number of cases within any home, so any single home or at the same address or within the same family, the maximum number of cases located at that one location would have been 5 during the period December 27th to January 9th. For the period January 10th to 23rd, there were as many as 6 cases in one particular home. We look a little bit deeper, and we look at the total number of cases within clusters which were linked to persons within the family or the same home or the same address. And during the period December 27th to January 9th, 19 out of the 38 cases, or 50% of those cases, were linked to at least one other person in the home or the same address. Whereas during the period January 10th to January 23rd, 52, or about approximately 55% of the 95 persons in total within clusters were linked to someone else within the home or at the same address or family member. Now, this highlights for us the need for us to continue to be vigilant and the need for us to enforce the current COVID-19 measures. We need to follow the guidelines and we need to be mindful of what we do, not just for ourselves, but for our elderly, the children, those who may have other risk factors in our environment, within our homes, in our neighborhood. We need to be conscious of these people. We need to be concerned of how our actions may impact them. As we go to the other slide, we look at the age-sex distribution of COVID-19 cases recorded within the clusters, as highlighted earlier, between the period January 10th and 23rd, 2021. Quite clearly, what we are seeing here is that the females outnumber males by approximately 55 to 45%. But what we are seeing is that that particular age bracket of 35 to 39, among both males and females, that particular age bracket stands out, highlighting the number of persons within that particular age bracket, which comes from the clusters. As we look a little bit deeper, we see that among the females, there's also the age bracket of 10 to 14 and 55 to 59, which stands out. Whereas among the males, the age bracket of 20 to 24 stands out. Again, highlighting the need for us to be cautious in what we do, because we may have elderly family, we may have kids around, and we may have persons with other risk factors who we need to be conscious of and who we need to be concerned about. Now, as we go to the next slide, we take a little deeper look into what is taking place in County St. George East. 7 out of the 14 clusters recorded during the period January 10th to 23rd were recorded in County St. George East, half of the clusters. And this amounts to 48 out of the 95 patients, which is approximately 51% of the patients highlighted or identified within these clusters all came from within St. George East, highlighting that something is going on there. There are clusters which have continued to show up within the same regions, highlighting that there is need for additional effort and personal responsibility in those areas. Taking a look at the clusters, we see that clusters 2, 3, 6, 8, 10, 15, and 13, which were highlighted in the previous slide, those clusters show that the highest number of cases within any cluster in St. George East was 12. Taking a look at the map, we see that the clusters are spread across the county, and it's not just in one particular location. These clusters are spread across the county. Of course, we take acknowledgement of that, given the fact that there is a higher population density in the area, and we expect that because of the population density, there may be increased spread. However, we need to be cautious, and again, it comes back to our personal responsibility. It comes back to us taking responsibility for our actions and practicing the measures put forward. We need to sanitize. We need to continue to wash our hands. We need to avoid the gatherings. And of course, as we mentioned earlier, the statistics of what is taking place within the home, we need to avoid gatherings at home. In fact, we need to avoid gatherings in total. But we need to avoid as much as possible home gatherings and parties, etc. So thank you very much. I'll hand over now to Candice.
Thank you very much, Mr. Seeramsingh. And we saw some focus there on County St. George East. And we have with us Dr. Fraser, the CMOH for St. George East, the man in charge. And he will give us some real-life examples of the spread of COVID-19 in the county that he manages.
Okay, thank you, Ms. Alcantara. Good morning, CMO and Mr. Seeramsingh. Good morning to Trinidad and Tobago viewing and listening public. I'm going to spend just a few minutes this morning talking through some of what we have been seeing in St. George East. St. George East extends from St. Joseph in the east all the way up to Arima in the west. Sorry, it's the other way around. St. Joseph in the west and Arima in the east. And goes north to Blanchisseuse and south towards central Caroni area. So before you get to Caroni, that's where St. George East stops. So it's a very extensive area. We have seen a number of clusters like Mr. Seeramsingh just identified. And in many cases, the clusters are connected to specific things going on in specific kinds of environments. And so I want to take some time this morning to just identify some of what we have been seeing as giving rise to the cluster cases that have been coming up. One of the areas that we find a lot of cases coming up are people who first picked up infection in a work environment. Just to give you an example, we have at least 2 separate instances of individuals who were positive at work. And when we did the contact tracing for those individuals, and these are now 2 separate individuals, 2 separate workplaces, each one of those had at least 15 contacts in the workplace. Now, a contact is defined as somebody who you've interacted with for at least 15 minutes, less than 6 feet apart, without the appropriate PPE, and in this case, without a mask. So in both of those cases, what would have happened is those individuals would have spent time at work talking, relating to, interacting with people less than 6 feet. Sometimes a mask might have been worn. Sometimes the social distance would have been breached. And so you found that we had just around those 2 individuals alone at work, there were 15 contacts each for those persons. In one case, of those 15 contacts, at least 7 other people became positive. And then you can then multiply that, because those people will then go home to their families and have the opportunity to spread it to their families. And so we find that a number of people who are coming to work, they're coming to work sick, and they are coming to work with symptoms, and they are interacting with other people, and so spreading the infection. One of the things that we also found, there was a particular case in which one person who picked up infection in the workplace took that home and infected 7 other family members in the home. And it is a testament to the fact that if you, in an environment where you are working all the time, you are interacting all the time, and you do not observe the public health measures, you can become a risk for your family members who are not at work with you, who themselves may be staying home and trying to do all of the things required, but then you who are going out to work, you then become a risk for those persons. So what's the message I want to kind of underscore, especially in the workplaces? Wear your masks properly at all times in the workplace, and encourage people around you to do so. So if you are sitting in a work environment, and what we found is in a couple of the cases that I just talked about, persons were sitting in very closed spaces. So even though they may have been observing a 6 feet distance, that was not something that they did consistently. And if you are working in an environment, in an office space, I know it's not the most comfortable thing to do, but you have to make a consistent effort to keep your mask on at all times. Maintain your social distance at work. I know if you are working in a space and you're there for 8 hours, the temptation is to become comfortable and to become lax. And, you're interacting and you're talking to the person all the time. The temptation is to breach that 6 feet distance between you and the other person. I'm imploring everyone to remember the distance makes a difference. It's the combination of all these things, your mask wearing and the distance and the sanitizing, all these things together make the difference. If you find someone is breaching your distance, very politely but firmly ask them to observe the distance. If you are interacting with your members at work and they are not observing the mask wearing, you can very politely and firmly encourage them to put on the mask. And the last thing I want to say about the workspaces is I want to encourage all employers to institute the public health measures that are there. and to find ways to enforce them as much as is possible. There are lots of people who have a nice hand sanitizing station when you get into the office space, or a hand washing station, but then you get into the office space and everything else breaks down. The space that people have to work in is too cramped, it's too small. People are allowed to be in those spaces without their mask for extended periods of time. So I want to encourage all employers to make sure the spaces that people are working in are adequate spaces to observe that 6 feet distance continuously, and also to ensure that people are wearing a mask. That is something that I think as an employer you can do. That's your contribution towards making sure that the spread of COVID-19 is kept down. A related thing to workplaces is people who go out to work or go out period when you are sick. We have had a number of cases of people when we call them because they tested and the test came back positive. And a lot of them say to us, "Doc, we thought it was just the common cold, or we thought it was just the flu, or we thought it was just our sinuses acting up." If you have any flu-like symptoms, my advice, and the advice we've been giving all the time, do not go out to work. Go and get yourself checked and tested. We have had a number of cases turning up with people who went out to work, and some of these people are working in very populated environments, and so they become the source of infection spread for others. If you are sick, stay home, get yourself checked. Some people are also ignoring your symptoms, and it's being written off as something else. And I'm just imploring you, if you have flu-like symptoms, and we have been talking for the longest while about what the symptoms are for COVID-19, but if you have them, please get yourself checked and tested. Do not ignore it and put it down to, hey, this is just a common flu, or my sinuses are acting up. Get it checked out. So the other thing I would say about the clusters that we have been finding a lot of is clusters occurring because of home gatherings. One cluster occurred with families who attended a birthday party. This was a family member who invited families over, relatives over. They came over. It was a big birthday party. These particular families that I'm describing, they generally follow the public health measures. But in this particular instance, when they got together, everything went out the window. Social distancing went out the window. Mask wearing went out the window. And the end result of that whole birthday party, we had at least 8 persons from that gathering ended up becoming positive. We have another instance of a family in which a few of the members started getting ill, but did not think this was something serious. And this is an extended kind of family, so lots of people living in the home. And in very short order, gradually over a week or two, 10 people within the home developed symptoms, and they all came back positive. And this started with 1 or 2 people just feeling ill, not taking it on, just have the flu, and passing it from one person to the next. And before we know it, we had 10 persons within that entire household becoming positive. So what's the message? Even within the context of your home, if you have someone coming into your home, encourage the wearing of masks, not just for the visitor, but for yourself. Put on your mask when the person comes into your home and make sure that person is wearing the mask. Encourage the social distancing. If you're sitting down in a room, try as much as possible to have that room very well ventilated. If that is not possible in every case, maintain a 6 feet distance. One of the things that we encourage is use the open air setting. Go out into the patio. Go out, take it outside of the house as much as is possible, because we are finding a number of cases popping up. And I think you saw the clusters that Mr. Seeramsingh referred to. Those clusters are just families and friends getting together for whatever the occasion is. And we have had a couple of cases that came up as a result of something that occurred around Christmas as well. And so I just want to implore people, keep your mask on when you have someone coming into your home. Ask that person to put their mask on as well. Maintain your social distancing. use outdoor spaces, or if you have to use indoor, make sure your indoor spaces is well ventilated. That would be those are the few less experiences we've been having in St. George East that I'm hoping will be a message not just for St. George East but for all of Trinidad and Tobago. I will encourage us to make sure we're doing the right thing to keep ourselves and our families and our loved ones safe and free from COVID-19. Okay, thank you very much, Ms. Alcantara.
Thank you very much, Dr. Fraser, and we look forward to a reduction in the numbers in St. George East. And of course, in Trinidad and Tobago, our numbers are low now, but we want to keep this up. So keep doing what you need to do. I think Dr. Fraser's message was all about consistency, even in your workplace, even in your home. And we go to our question and answer segment. Our media representatives are familiar with the requirements. 2 questions, please, 2 brief to the point questions. And we ask for both questions at the same time. And we will come back to you if we have additional time. We begin this morning with questions from AZP News.
Hi, good morning. Priyabi Hari, azpnews.com. My first question, it seems in St. George East, and I think in other parts of the country, people are not taking it seriously when they have flu-like symptoms. They are not staying home. They continue to go to work. Is the ministry going to maybe change the way it does the communications now, maybe target that specific issue, because some people feel that they cannot get COVID and they continue to go about their business as normal. And my second question has to do with the whole issue of the vaccines, CMO. When the vaccines, come into the country, how is it going to be determine that someone has comorbidities and he is eligible to get that vaccine? Is the ministry going to put a system in place for that, and how is that going to work? Thank you.
Okay. Yeah, thanks, Brian. So the communication plan has evolved throughout the pandemic. There has been multiple changes. We are trying different avenues to get persons, but the messages, as Dr. Fraser put it, remains the same. Those 6 or 7 key messages that we have been trying to get out from day one: wearing your masks, staying 6 feet apart, and of course, what we touched on in terms of persons not going to work ill has become a serious driver of the disease in Trinidad and Tobago. So of course, we will continue to evolve our communication strategy as we go, looking at targeted populations. We're actually doing some surveys at this point. Hopefully, based on those target groups and surveys, we can get a little more, a better idea of what is really happening and driving those sorts of behaviors. And of course, the campaign can be more targeted towards those things in the future. So it will change as the days and weeks go by. With regards to the vaccines, we have 2 strategies. So one, as we speak, we have actually already received from NIPDEC the list of all persons who are on the CEDA program. There's upwards of 80,000 people. So we have that list. What we're trying to do is create a master list of all the persons that will be eligible in the first phase of the vaccination drive. So we're looking at healthcare workers again. We're looking at persons with NCDs. We're looking at persons over 60. So we have written to the relevant ministries and regional health authorities that have that information to try to get it back as early as the end of next week. So once we have that list compiled, we have that the data with someone's address, phone number, and we can actually use that to call persons in for vaccination. So that's the active way. Passively, people can actually, with regards to NCDs, they can attend their normal clinics, and we will vaccinate you when you come, or offer vaccination when you come to attend, for example, your diabetes clinic or your hypertension clinic. And thirdly, we are looking at the possibility, if you have walk-ins, you will be assessed to see if you meet the criteria for vaccination in the first phase. And once you meet the criteria based on a history taken by your physician or by your nurse, then of course you'll be allowed to be vaccinated. So those are the 3 ways we are looking to stick to our phase 1 priority. And then of course, as we get more vaccines, to go into phase 2 and the other parts of the population.
Thank you very much, CMO. We go now to CL Communications, please.
Good morning, Natalie Singh. I just wanted to find out, South Carolina is reporting that the African variant is on the move as community spread. How worrying is this for Trinidad, given that this country is about to increase the number of people repatriated from the US? And then my second question is Trinidad interested in the Johnson & Johnson vaccine that is being talked about internationally?
Right. So the first question about South Carolina, we knew for some weeks now that we did have the variant in the US, and expectantly so the numbers would increase in those territories once they get into the community, based on the fact that we have known the transmissibility is upwards of 50% more than the initial strain of COVID-19. So we anticipated that. As you know, we have maintained our quarantine, state or state supervised quarantine throughout the pandemic. There hasn't been any period where we have gone away from that and allowed home quarantine, unless you come from a very low risk, which has been a minimal number of people throughout the period. So maintaining the quarantine, maintaining the 72-hour PCR prior to entry, and as well a day 6 PCR test gives us somewhat of an assurance that we're able to catch 90% plus or a large proportion of those coming back through repatriation and being managed through the borders. So we can be confident that we, especially those through US, we had started to pay particular attention to the UK a few weeks back when they had determined on December 1st to be the first country with the UK variant. So we actually extended the quarantine period in state or state supervised to 14 days at that point. We maintain for the other countries for now. We are, of course, looking at the day 6 to see who are positive, and those will be sent, as you know, for sampling and for genomic sequencing to the UWI to see if we're picking anything up. So we are concerned. As is the rest of the world, we see closures of borders to other countries. In Canada recently, and Germany has closed their borders to certain countries with the variant. Australia has said they're not opening until 2022, possibly. So there's closures of borders occurring all over the world to try to keep the variant out. As you know, our borders remain closed, and we heighten our quarantine alert as people come back into the country. As it relates to the Johnson & Johnson vaccine, it has not been approved by WHO at this point. However, it is a one-dose vaccine, which is, in terms of administration and getting persons to take it, it is a little more, persons tend to be more compliant, so you don't have to come back in for a second time. So we are keeping an eye on it. We are possibly looking to have bilateral talks with them as well, as the days and weeks proceed. And if it goes into the COVAX facility and is approved by WHO, of course, we will get it through the COVAX as well. So we are looking at that vaccine as well.
Thank you very much, CMO. And we go now to Newsday, please.
Good morning, Larissa Fraser from the Newsday. My first question has to do with the reopening of schools for particular students. A while ago, the education minister would have, in an interview, said that there would be nurses to check on children who have flu-like symptoms. Can you elaborate on that? So the nurse checks them, and then what's the next step? And is it that there are going to be particular nurses attached to a specific school or 3 schools, or how is that process going to be?
Okay, so that process is under the remit of the Ministry of Education. So they had a press conference, and I suppose that question can be answered in more detail by them, because the nurses and physician to be hired in that regard would be from the Ministry of Education and form part of their team. So they will have to guide on that question.
Thank you. And we go to a follow-up question from CL Communications, please.
Hi again. Concerning young people going back to school, what is the process like when it comes to monitoring them? Because they would tend to want to gather together and congregate together, and you have warned numerous times not to congregate. But how are you going to monitor these young people and prevent them from congregating, especially when they have to take their public transportation back home?
Right. So as you know, the Ministry of Health, we would have had a press release out the day after, I think it was Thursday last week, we would have met with the Ministry of Education, indicating that we would have collaborated, and even prior to that, we would have had meetings with them related to guideline formulation and those sorts of things. However, the the ministry's role is to give technical advice as it relates to the guidelines, which we have done. I think the ball is in the court of the Ministry of Education at this point to finalize their protocols and procedures, and really, we wouldn't want to overstep our bounds as the Ministry of Health to go into their territory. So, again, we would have given our technical advice, but that question can be best placed to Ministry of Education.
Thank you very much. And just want to move into some questions that we have been seeing coming in from the public domain, and some questions that have come up, of course, based on the presentations this morning. Just wanted to ask Dr. Fraser, at the Corporate Communications Unit, we do get quite a few businesses that call and they say that, a member of our staff has either tested positive for COVID or is highly suspected of being positive for COVID-19. What kind of advice are you giving to businesses in the St. George East community in those instances, Dr. Fraser?
Okay, thank you very much, Ms. Alcantara. Generally, the way we track cases, we will contact someone who is positive when we get that positive result, and there's a system that the ministry has in place that gets those positive results all to all the CMO's H office. So we would make contact with those individuals. If that individual is working in an environment that is not like a self-employed environment and there's other people there, we will then advise the businesses through the contact tracing mechanism of possible exposure. And then depending on the degree of exposure, we'll advise on sanitizing and closing for a period of time, depending on whatever is required. But we generally tend to work hand in hand with the employers to make sure that whatever exposure that might have been taking place, that those people are quarantined and that the business itself, the physical environment is sanitized and prepared for work. So, and generally, I'm just going to repeat the thing about people who are ill or people who are positive. Everyone who is ill should not be coming to work. If you are positive, you should be in quarantine. And the businesses need to encourage or to allow for the contacts of those people to be in quarantine. Sometimes we've been told many times that people are unwilling to go and test because they do not want to be quarantined, because the business owner or the employers are not willing to allow quarantining. And if they quarantine, they will lose their jobs. And we've also had people who have been contacts of positive people who said to us that, Doc, I cannot stay home for 14 days because I'm going to lose my job. And so part of what we have to try and do as much as possible is to work as a society to make sure all together we do our part to make sure that the virus doesn't spread. So my word of encouragement to businesses would be to, while you are doing what you have to do to make sure that you are instituting your public health measures, from the county medical office of health standpoint, when we quarantine people, we expect that they are given the leave to be able to do what is required and to stay home for those 14 days.
Thank you very much, Dr. Fraser. We also get questions, and I think this one is for CMO, about the WHO and the emphasis, because you've said quite a few times that, we depend and look to the WHO for the approval for the use of a vaccine. Why is there so much emphasis on WHO when there are other entities in Europe, in UK, or the FDA, for example, in the US?
Well, I mean, WHO is the organization that usually for vaccination, most of the vaccines that people use over the world are actually distributed through the revolving fund of the Pan American Health Organization, which is an agency for this region of the world under WHO. So they would have a robust technical advisory group, which I indicated is called the SAGE group, which actually looks at vaccines throughout the world in terms of their trials. And it is really made up of persons from many parts of the world. Below that group, as I said before, there's a regional TAG group, and there's regional advisors from PAHO, which also look at the information coming out of there. So the robustness of the technical advice goes a long way in terms of making that final decision for member states. We also use for not so much for vaccines, but for medication, for example, aside from WHO, and you mentioned other territories. There's stringent regulatory authorities, for example, the European Medical Association and FDA, the Canadian system as well, that we use Reliance. But for this particular vaccine, because it's being licensed for emergency use, we would prefer in Trinidad to stick with our WHO counterparts to ensure that the rigor that needs to go into those vaccination formulations and trials is what it's supposed to be before we use it in Trinidad and Tobago.
Thank you very much, CMO. And some questions that just came in from some media colleagues who could not attend this morning. One question is for Mr. Seeramsingh, and the question asks, how is GIS mapping being used by the CMO and his clinical team? And a question for Dr. Fraser. What interventions have been put in place in St. George East to curb the spread of COVID-19? So we can go to Mr. Seeramsingh for the first question.
Thank you very much for the question. The GIS has been used and is being used in many different ways within the ministry right now. With respect to the clinical team, we have been engaged in and participating in several things which is expecting to be rolled out very quickly. We are looking at supporting the vaccine rollout initiative. That is one particular area in which we are currently working. Of course, you would appreciate the nature of GIS and location as an important tool here, and understanding where are these people who need to be vaccinated, who need to come back in for vaccination, where do we have uptake and where we need to work on. So the GIS team is actively working with the wider team to roll out the vaccine initiative. Beyond that, we are also currently working together with the CMOHs as we work to introduce an electronic contact tracing form, which will help us in terms of data collection and transfer. So we'll be able to transfer data a lot more expeditiously from the county level up to the epidemiology division level and the GIS, where we can map and analyze data a lot more quickly. So those are the two initiatives that we are looking at right now, but there are other things which we are also working on, which we will spread and we will share soon enough. Of course, one of the things which we mentioned previously, which is being finalized right now as well, is the facilities finder tool, which we will be sharing sometime in the near future, as we are currently just finalizing the data which will be used in the background for that particular app. So thank you very much.
Thank you very much. And now Dr. Fraser.
Okay, so for the cases that I mentioned, I think I identified two big areas where we find the sources of the clusters: family gatherings and workplaces. One of the things that we have done is continue to increase our messaging. We've worked very closely with corporate communications, both in the Ministry of Health and with the NCRHA, and increase the kinds of messaging that is relevant for our population and the areas where we're finding a lot of cases. We have also identified a number of repeat offender workplaces, so to speak, and we are going to be going to those places with a specific messaging given the data that we have been seeing, and talking to them about making sure those public health measures are kept in place. The other thing I would say that is not just St. George East, but across the board, our public health inspectors have also been doing a very good job of making sure the businesses and other places at least have a plan to deal with to put into place or to implement the public health measures. And they've also been very instrumental in helping to monitor the plan's implementation. So those would be some of the things we've been doing so far, and we'll continue to change the strategy as the epidemic continues.
Thank you very much, Dr. Fraser. So this is an ever-evolving response to a very dynamic pandemic. We go now to another follow-up question from CL Communications, please.
Hi. I just wanted to find out, since the onslaught of the variant and the various news reports on it, how has the ministry had to change Trinidad's response to the COVID-19?
Well, I think our response has just been heightened surveillance with regards to the variant itself. Having now had the capacity at the UWI through the study, we are in a place that we could actually detect it. So what we're doing is we created a criteria for persons who tested positive. Anyone who is repatriated and test positive, those persons are subtyped to see what is happening. And we have some other categories that we're looking for persons within the country as well. So that criteria is known to the Caribbean Public Health Agency. And of course, once we get samples of that nature, it goes across to UE. So the main thing is to first keep a very close eye on the persons that are coming through the border to ensure that they don't bring the variant with them when they come in. Trying to keep the variant out is the first line of defense in terms of border control. And then, of course, continuing to sample persons in the population to see if the variant has managed to get in some form or fashion. And of course, being cognizant of what is happening in the other countries and preparing by way of technical knowledge for the variants. There are 3 variants of concern at this point. So building the knowledge as we did for COVID-19 on its own to have the technical oversight over the way the virus is behaving in terms of transmissibility gives us ideas and predicts the way we should tailor our public health measures. For now, we have maintained somewhat of a measured approach where we continue to maintain what we have started before. But as the virus evolves, we may have to change certain strategies, but the research has not suggested that, at least for Trinidad at this point.
Thank you very much, CMO. And we have come to the end of today's media conference. Thank you very much for joining us. Today, we were reminded about the transmission or the spread of COVID-19 and the importance of following all of the new normal guidelines. Even in those places where we feel safe, like in our workplace with our work colleagues, even in our homes with our family members, especially if those are persons who are coming from outside our little family bubble and they come to interact with us. So it's very simple. If Auntie does not live with you and she comes over for something very important, we still have to follow the new normal guidelines. Everyone, we can do this, but we must remain vigilant. We must remain committed. Consistency is the key. We go now to a WHO video to close. Be safe. Stay away from others outside of your safety bubble. And of course, as I always say, please wear your mask.
The majority of transmission that we know about is that people who have symptoms transmit the virus to other people through infectious droplets. But there are a subset of people who don't develop symptoms. And to truly understand how many people don't have symptoms, we don't actually have that answer yet. So when we say asymptomatic, we mean somebody that does not have symptoms and does not go on to develop symptoms. Truly no symptoms. We know a number of them who are reported as asymptomatic actually may have mild disease. They may go on to develop symptoms. They may not quite register that I'm sick. You know, I just feel a little bit unwell. I'm just a little bit under the weather. I'm feeling a little bit fatigued. And some of those individuals we would classify as pre-symptomatic, which means they have not yet developed symptoms. We know from some of the viral shedding studies, from some of the lab work, that there are people who are infected with COVID-19 that can be PCR positive, that can test positive 1 to 3 days before they develop symptoms. And that's something that we've known for quite some time now. What we need to better understand, and this is one of the major unknowns, is what proportion is contributing to transmission.
When you sing or you're shouting in a nightclub because you can't hear your friend and you're saying, you know, can you hear me? And you're close by and you're projecting your voice at someone, then it's clear that in that situation, if the virus is present in your upper respiratory mucosa, then there's every likelihood that you can project that virus. The last couple of days have been the highest number of daily cases in the world. So in terms of pandemic generation, we are still very much on the upward climb on this mountain. But what some countries have shown, many countries have shown, is if you go at this in a very systematic way, and you use a comprehensive approach, that there is enough stoppability in the virus. We've seen that with the physical measures, social distancing, we've seen it with surveillance. And we have some choices to make as a society, because it is clear, if we can identify cases and their contacts, and we ask those contacts to quarantine themselves, and we support them in that quarantine, that can be a very successful way of both stopping the disease and avoiding large-scale lockdowns in future.